Hi, I'm Sarah Erickson, and I'm the Health Information Manager for Sunset Manor Avera. So some of my duties under my title are booking appointments, all the scheduling for the transport drivers, the appointment paperwork, doctor rounds, lab visits. So I started out doing the Health Information Manager position, and a few years later they came to me and asked if I would like to be a CNA as well, just to help fill in the void, like if there's bad weather or if someone called in sick. And then a few years after that, they asked me if I'd like to do the med aid position. When I first started, I thought, I was going to be answering the phone, scheduling appointments, but I never thought I would become a CNA and a med aid and work in infection control. I love learning new things. Also, since starting here, I've become a first responder and I'm also an EMT. I would say a lot of the daily skills here help me out in the field. Spending time with the residents, just helping them when needed and being a listening ear if needed. Well, I think over time you've just become family with the residents as well as you're basically their family for some of these residents. So sometimes doing simple things like their hair or painting their nails just brings them joy, or just listening to them. It's very rewarding to know that you've helped someone out throughout the day that maybe just needed someone to listen to. Living in a small town has always been a positive. So I think people are under the assumption that you're not able to grow in this field being from a small town, and I would not find that true. I feel like I've definitely grown over the years that I've been here in all the positions that I've held and have added on since I've started. As an EMT, I do feel like I'm giving back to the community. Even growing up, my family was always really involved with community events and doing community things, and I think the best thing about living in a small community is people really know how to come together when they're needed. If you have the passion to do it, try becoming like a CNA in high school, because I think if I would have done something like that in high school, I probably would have been in the healthcare field well before I was.